Hi, welcome to PH Insights, presented by the Pulmonary Hypertension Association. Join us as we delve into patient stories, healthcare updates, and the latest insights on pulmonary hypertension. Thank you to our platform sponsor, J&J, for their unrestricted support of PH Insights. Sponsors do not endorse or participate in the development of program content. Hi, I'm Angela, and welcome to the latest episode of PH Insights. Today we're speaking with Dr. Mrinalini Krishnan, the Regional Director of the PH program at MedStar Heart and Vascular Institute. Dr. Krishnan, thank you so much for being here. Can you please share a little bit more about your background and specialties?
Thank you so much for having me. My name is Dr. Mrinalini Krishnan. I'm an advanced heart failure and transplant cardiologist specializing in pulmonary hypertension, and I run our pulmonary hypertension program regionally at MedStar between Washington, D.C. and the Baltimore area.
It's such an honor to have you on this episode. You came highly recommended by members of our patient and education committee here that we have at PHA, so I appreciate that. And I appreciate you providing this overview of left heart disease. I know in the planning we were talking about it, but in 2025, it is my goal to paint a clear picture of pulmonary hypertension, its causes, treatments, and how to improve daily living. Within that, I want people, our audience, to have a better understanding of who groups of PH. Many may not even be familiar of what that is. And so for our listeners, there are 5 types of PH based on different causes, or 5 groups. These are often called the WHO groups of PH. And particularly for this episode, PH caused by left heart disease is also known as group 2 PH. So, Dr. Krishnan, can you take it a step further and explain a little bit more about left heart disease and how it's the most common cause of PH?
Yes, I'm happy to. So the way that I explain this to my patients is all the blood in our body works in a circuit. So the blood in our body comes back to the right side of our heart. Our heart has a right and left side, and each side has a top and bottom. So the top are the atria, the bottom are the ventricles. So all the blood from our body comes back to the right top or the right atrium, then across the valve into the right ventricle, the right bottom, which then gets pushed into the pulmonary arteries or the lung arteries. That's where we're talking about the pressure being high in pulmonary hypertension patients. So then that blood gets into our lungs, gets oxygenated, and the blood with oxygen comes back from our lungs to the left side of the heart, where we have the left top, left atrium. We have a valve that it crosses, which is the mitral valve, goes across to the left ventricle or the bottom chamber, and then that left ventricle pushes the blood out across another valve, the aortic valve, out back to our body. So body, right side of the heart, lung arteries into the lungs, then left side of the heart and back to the body. So if you have pulmonary hypertension or high pressure in your lung arteries caused by the left side of the heart, basically what's happening is something on the left side of the heart is causing that pressure to back up into the lung arteries, causing the pressure to be higher, which is called pulmonary hypertension due to left heart disease or group 2 pulmonary hypertension. The main things that can cause that on the left side of the heart is, one, if the left ventricle, the left bottom chamber, either is too weak to squeeze forward, which is called systolic heart failure, or the left ventricle is too stiff to relax to fill up with the next beat of blood. So either of those 2 things can cause backing up of the blood and therefore that back pressure to cause pulmonary hypertension. The other thing on the left side of the heart that could cause pulmonary hypertension is if those valves that I mentioned have issues. That mitral valve or the aortic valve is stiff or is leaky. Either of those things can then cause back pressure to happen. And the way I explain that again to my patients is if you have a garden hose and you pinch down on a garden hose, behind it gets that back pressure or that stretching. So that's what happens here. If something's going wrong with the left side of the heart, that back pressure then causes the pressure in the lung arteries to be higher, and that can in turn cause back pressure to the right side of the heart and fluid backing up into your body, etc.
I know that was maybe a lot of information. I kind of want to connect to left heart disease. If you are dealing with left heart disease already, and this is happening to cause PH, will you instinctively know, or is it something where you may live with those symptoms for quite some time before you even realize that you may have PH?
Yeah, so it's one of those things like hypertension, high blood pressure, right? Pulmonary hypertension, when you have that high pressure happening, you may or may not realize that it's happening. But if you have uncontrolled or under controlled or undermanaged left-sided heart disease that's happening, then that could silently be making that pressure higher over time, which is then affecting your lung blood vessels, your pulmonary vasculature, and then therefore affecting your heart.
I think that's an important point to make it clear up there for those listening. So as I record these episodes, we hear about the typical signs and symptoms. We've talked a little bit about that briefly. Are there any unique signs besides like shortness of breath, which we see is typical someone with left heart disease should pay attention to for PH?
So with anybody that has pulmonary hypertension, regardless of the cause of it, you are looking for shortness of breath, like you mentioned, but that back pressure that I mentioned causing the right side of the heart to work harder, if the right side of the heart can't keep up, then that backs up that fluid. So people can certainly have fluid in their belly, fluid in their legs. They can have difficulty breathing when they try to, even just sitting or trying to do simple things like getting ready in the morning, that kind of thing. Specifically to left heart disease causing pulmonary hypertension, as I mentioned, the left side of the heart is backing up that pressure or that fluid into your lungs. So a little bit different. You can certainly get where you have fluid in your lungs also causing symptoms beyond just shortness of breath. And that's called orthopnea, where you can't lay all the way flat. If you try to lay flat, the fluid in your lungs kind of fills up. And so that makes you feel out of breath when you try to lay down. Or even paroxysmal nocturnal dyspnea, or PND, we call it, which basically means through the night. Because of that fluid in your lungs, because you're laying flat, the whole back portion of your lungs is getting that fluid affecting it. That makes you feel like you can't breathe. So you wake up at night feeling like you can't breathe as well. So those are unique to left heart disease causing pulmonary hypertension.
I don't think I've heard that before. The fact that it impacts your sleep that way. Is this the person who only sleeps well in a chair where they should be thinking and having these conversations with their doctors? Because that's what instantly comes to mind of someone who's like, oh, I can't sleep in the bed. I can only sleep well in this rocking chair or this like lazy boy.
Yep, that's exactly right. So when I hear from somebody, I ask everybody, are you able to sleep with one pillow? And do you wake up at night feeling like you can't breathe? And when somebody says to me, I can only sleep in my recliner, or I have to prop up 6, 7 pillows to be able to sleep, that's a red flag to me to say they probably have some left heart disease backing up and causing fluid in their lungs.
If you're listening to this, as with anything discussed here, it is important to always talk with your medical team about it and make sure that there aren't any underlying issues or causes. Additionally, if you are living with left heart disease, there are some determinants that you should take into consideration when seeing if you're at risk for developing PH. Dr. Krishnan, can you go a little deeper into some of the risk factors here?
Yeah, absolutely. The obvious ones are the ones that I mentioned. So if you have known heart failure, whether it's systolic or heart failure with reduced ejection fraction, weaker heart causing heart failure, or if you have diastolic or heart failure with preserved ejection fraction or stiff heart causing heart failure, either of those could certainly lead to pulmonary hypertension. And then along with that, as I mentioned, the valvular diseases. So if you are known to have either mitral stenosis or mitral regurgitation, or same thing with your aortic valve, aortic stenosis or aortic regurgitation, that could certainly put you at risk because of that backing up of pressure that we discussed earlier. Some of the other things that put people at risk in general for left heart disease and developing some of the things that I just mentioned, of course, as we get older, so age, coronary artery disease or blockages in the heart arteries puts you at risk for having heart failure, right? So that would certainly be something to keep in mind. And then our usual things that put us at risk for left heart disease would be atrial fibrillation or irregular heartbeats in the top chambers of your heart, obesity, diabetes, high cholesterol, all those things go hand in hand and could certainly contribute as well.
I want to go back there to the regurgitation. Can you explain that a little bit more for those who aren't familiar?
Yeah, so this is what I was talking about a little bit earlier when I said a valve can either be stiff, meaning it doesn't open properly, or it can be leaky, where it's actually backing up. So if a valve is stiff and not opening, we call that stenosis. So if you have mitral stenosis, for example, that's the valve on the left side between the top and bottom, the mitral valve not opening properly, which can then cause back pressure into your lung arteries. If you have mitral regurgitation, that means that mitral valve opens, the blood goes forward from the left top to the left bottom, but then when it goes to close, it's leaky. So that regurgitation happens, causing that back pressure. Similarly, that could be with your aortic valve, where the aortic valve either doesn't open properly, which is stenosis, or it leaks back that blood, which is called regurgitation.
Do doctors typically welcome sharing all this information, asking the questions so that a patient can get a better understanding?
Yeah, I think I try to empower my patients. I mean, at the end of the day, it's your health and it's your life. So I try to make sure my patients understand what's going on with their hearts. And asking these questions is how you potentially may end up, leading to getting more treatment or more interventions, things that you might need that will actually help you do better, live longer, feel better, right? So I think no doctor is going to necessarily be insulted if you start asking them, do I maybe have pulmonary hypertension? Worst cases, they say, or I guess best cases, they say, no, you don't. And if you do, then that's something that they can also try to focus on. And we're going to talk a little bit about treatment and that kind of thing, but the focus with left heart disease is really just treating your left heart disease. So whether you have pulmonary hypertension or not caused by the left heart disease, really just optimizing the medications and treatments, therapies we can do for the left heart disease is still the answer. So it's not that you're going to be asking them to add some crazy medications or do some crazy procedures or anything like that. So I couldn't imagine a physician being insulted or anything like that if a patient were to pose the question, hey, is there a chance that I have pulmonary hypertension caused by all these things going on the left side of my heart?
Thank you. I know that it will help out our audience, which that is a great segue into this diagnosing and understanding. Is there a specific procedure or a way that a doctor may diagnose PH in someone living with LHD or left heart disease?
Yeah, so anybody that we are trying to determine if they have pulmonary hypertension, the first screening test that we do for their heart is called an echocardiogram, which is an ultrasound of your heart. So I explain to people, it's like when you're pregnant, jelly on your chest instead of jelly on your belly. And that way we're able to actually see all the parts of the heart that I mentioned, the right and left side of the heart, top and bottom. You can see those valves, you can see leakiness, stenosis, that kind of thing. You can also see if there's fluid around the heart, which we look for in pulmonary hypertension patients. And it gives us an idea of what the pressure is in the lung arteries. So based on the pictures we're taking, we get at least some measurements to clue us in to say, is the pressure normal or does the pressure look higher than it should be in the pulmonary arteries? This is a non-invasive, just jelly on the chest screening test that we do. The definitive test to figure out if someone truly has pulmonary hypertension is an invasive test, which is called a right heart catheterization. And that's where we use a catheter and go into the right side of the heart, hence right heart catheterization, and we actually measure the pressures. And so that one, if somebody has an echocardiogram that is suggestive that they have pulmonary hypertension, then it may be appropriate to go the next step and have the right heart catheterization procedure done. Typically what they do is they'll numb up your skin and they'll go in either through your neck or through your groin, numb up your skin, use a needle to get into the vein that's there, and then use that catheter to follow that same pathway, follow the blood vessels into the right top of your heart, right bottom of your heart, and into your lung arteries, measure all the pressures, and then take everything out. So this is something routinely same day procedure that I'll have my patients come in and do to then figure out exactly what the pressures are and also help figure out, is it the left side of the heart that's causing that back pressure and causing their pulmonary hypertension? So that test is really great. It tells us, one, do they have extra fluid in their body? Two, do they have pulmonary hypertension? Are those pressures actually higher in their lung arteries? Three, is the pressure that's high because of the left side of the heart pressure is being higher? So do they have left heart disease causing pulmonary hypertension? And four, how well is their heart getting blood around their body like their body needs? So it really does give us a lot of good information. And I tell people, you won't know for sure if you have pulmonary hypertension until you've had a piece of plastic inside your heart, having this heart catheterization done.
And how soon, once that is done, will someone know? Will you get the results back, or do you see it instantly?
So it's in the moment. Yeah. So while we're there, we're measuring the pressures, and typically right after the procedure is done, we're able to tell the patient, do they have extra fluid? Do they have pulmonary hypertension? Is it because of the left side of their heart? And is their heart still able to get blood around their body like their body needs?
If you've heard of pulmonary hypertension, you've heard of the right heart cath, you've heard of the echo, and I think that within all of these groups, we have that standard process for diagnosing that seems to apply. Is that true for the treatment, though? Are there different treatment options? And how do you maintain the quality of life and treat someone living with PH caused now by LHD?
Yeah, so the first thing I tell all my patients the first time I meet them, and even on repeat visits, is please don't Google. If you Google pulmonary hypertension, the things that you read about from not legitimate sources will make you feel like you're going to die tomorrow. So, just to put everything into context, I remind them, go to legitimate sources like the Pulmonary Hypertension Association website and read actual data that pertaining to their exact condition. Because when you Google, the type of pulmonary hypertension that you will read about is, one, not pulmonary hypertension because of left heart disease, but then two, it's also outdated. It's from a time where we really didn't have treatments, therapies for the type of pulmonary hypertension that they're talking about. So people come in panicking and thinking that they're in their dying days, and then I have to bring them back from that and explain what's going on. So pulmonary hypertension because of left heart disease is actually the most common type of pulmonary hypertension. And you can imagine why, because it's caused by all those things that are much more common. People having heart failure, people having valve disease on the left side of their heart, all those things are much more common than just pulmonary hypertension because somebody was born with it, for example. So when we talk about treatment for pulmonary hypertension caused by left heart disease, we talk about treating the thing that's underlying. So if somebody has systolic heart failure or heart failure with reduced ejection fraction, there's typically 4 medication groups that we use to help those people's hearts get stronger and help them live longer. And that's certain beta blockers. That's either an ACE inhibitor, an ARB, or an ARNI medication. The third category is your MRAs. And then your last category is your SGLT2 inhibitors. So those 4 medications all work differently, and all those 4 medications help people's hearts get stronger and help them live longer. And if they have pulmonary hypertension caused by the left side of their heart, then it would improve that as well by improving their systolic heart failure. With people that have heart failure with preserved ejection fraction, we use some of those medications, but not all of them. But the thought process is the same. You try to use those medications to then help the left side of the heart do better. And by doing that, you improve their pulmonary hypertension. For people that have valvular heart disease, depending on how bad their valvular heart disease is, so if people have the leaky or the stenotic valves that I talked about, right? It can be mild, moderate, or severely leaky or severely stenosis. And those patients would then, if they're mild or moderate, we would monitor them and we try to keep on top of, make sure they don't have extra fluid in their body, that kind of thing. But once it gets to severe stenosis or severe regurgitation, then we can sometimes do interventions like putting in a new valve surgically or through the groin less invasively. So there's things we can do to then replace or repair those valves so they work better. And if they work better, then that will improve the pulmonary hypertension caused by that back pressure.
Thank you. And I want to put that we have resources on the PHA's website. We do have a brochure that gives an overview of what we've discussed here, but also with all of these treatment options, whether it is through an oral intervention or a surgical intervention, please always consult your medical team because it may not be where a patient requires all of them or there's a certain combination based on their individual needs.
Correct.
That their doctor may recommend. And I just wanted to clarify that.
Yeah, so that's exactly right. It'll depend on people's kidney function and if they're able to tolerate some of these medications or if their potassium runs high. So there are going to be caveats to it. But in terms of upfront medications that we use for people that have heart failure, those are the 4 categories of medications that we try to get people on because we know by using those, and I tell people you get bigger bang for your buck if you get on the higher doses of the medication. So the highest dose people can tolerate, the better effect you get for your heart as well from those medications, which is great. The other thing I want to mention, which I always talk to my patients about as well, is sometimes when you start reading about pulmonary hypertension, you'll start reading about these special medications that we can use to bring the pressure down. So those are called pulmonary vasodilators, or medications that specifically open up those blood vessels in your lung arteries to then bring that pressure down. So the way that I describe that for patients with left heart disease is if you start using medications that are going to open up your blood vessels in your lung arteries, you're basically opening up the floodgates to the left side of the heart that we know was not keeping up to begin with. So you're actually going to end up feeling worse instead of better. And so patients with pulmonary hypertension caused by left heart disease, we do not use pulmonary vasodilators for, because that, and actually I would say it's contraindicated. We should not use medications that open up those blood vessels, because we will certainly make patients feel worse.
So thank you for clarifying that and giving us some advice that patients can talk about these things with their team, ask the questions, guide them on what exactly is the typical treatment, but understanding that may not be the treatment for you specifically. It deserves a conversation with your team. But as we wrap up this episode, are there any lasting points that we didn't get to cover that you usually talk about with your patients you would like to share here?
Yeah, I think the biggest thing is to try not to ignore your symptoms. So you know your body, and if you find yourself where you were able to do something like walk up a flight of stairs or walk the block, and you were doing that comfortably and totally fine a year ago, and now you find yourself avoiding it, trying not to do it. I have patients that tell me, like, I just don't take stairs anymore because they don't work for me. That to me is a red flag, because that tells me you are limited by something going on with your body, and you've then adjusted your life to just avoid doing that because you know you can't do it, right? So it's not that you're actually doing fine, you've avoided what you're not able to do. And when I meet somebody, that's very telling of how they've actually been doing. So if you find yourself, waking up at night feeling like you can't breathe, or propping up more pillows to sleep at night, or you're used to walking the dog around the block and now you have someone else do it because you just can't get more than a few steps before getting out of breath, that's your body telling you that something's wrong, and you should really get evaluated either by your primary physician and or by your cardiologist or pulmonologist, and see what else might be brewing. Because the earlier that we catch some of these things with pulmonary hypertension, the earlier we get people managed and treated, the better they do and the longer they live. So it's really important to not ignore symptoms and never feel intimidated or afraid to bring up those things to your providers, because that's what we're here for. We're here to help you figure out what's going on with your body and ultimately help you do better and live longer.
Thank you. Thank you for saying and reinforcing that fact to bring this up with your providers. Because I do get those calls where people just feel intimidated. And it's not that their doctor has done anything. It's just that idea of, well, they are the expert, I shouldn't ask questions, that kind of feeling. So I appreciate you hitting that home for our listeners. I think that covered a lot. I really hope that this jumpstarts us looking deeper into PH. I think there's still so much more we could explore, take it to another level within PH caused by left heart disease, and which we will do in the future. And hopefully we can include you on that, Dr. Krishnan.
Yeah, that would be great.
Well, thank you for being here again. And thank you for listening to PH Insights presented by the Pulmonary Hypertension Association. Remember to subscribe and to join us every second and fourth Wednesday of the month for more valuable insights. And thank you to J&J for their unrestricted support of PH Insights.